Hey, everybody, welcome back. So, today I wanted to go over a few of the things that we, your healthcare team, monitor with you throughout the year to manage your diabetes with you. And we're going to go over the first big three ones. They're called the ABCs. So, everybody knows the big one. A, it's your hemoglobin A1C. So, again, that's an average of your blood sugar on a daily basis for the 3 months before you had your blood work done. So I've got a slide here and it can show you. So these are how you can, sort of keep track of where your A1C might be at. So the numbers, the blood glucose numbers on a daily basis, you can see what the corresponding A1C, estimated A1C is. So if you're monitoring blood sugars either via finger stick or with continuous glucose monitoring, you're going to be able to have an idea, in between healthcare provider visits, where your diabetes management is at. So the other thing too, so target range for A1C, this is going to change over time, and things that are going to change your target goals going to be age, how long have you had diabetes, how many other health conditions might you have. So that's a very personalized thing. You're going to talk to your healthcare provider about that. And again, it's going to change over the years. The recommended goal for most people with type 2 diabetes from the American Diabetes Association is 7 or below. And that's 7 or below as long as we make sure that we're not giving you a whole bunch of hypoglycemia, because you remember we talked about that last time. We don't want that hypoglycemia happening often, if at all. The next thing, so the B, is blood pressure. And many people with diabetes take blood pressure medications. Specifically, 2 classes are used a lot for people with diabetes, and they're called ACEs and ARBs. And in a few months, we're going to have our pharmacist be doing some much more in-depth sessions with you about medications. So she can explain to you a little bit more what those are and how they work. But they're used for not only blood pressure, but they do help protect the kidneys. So even if you don't have high blood pressure right now, your healthcare provider might want you to take one of those at a very low dose to help protect your kidneys. And if you do have high blood pressure, recommendations are for most people to have a blood pressure at 130 over 80 or below. So then there's the C. That's your cholesterol. More specifically, what American Diabetes Association and other diabetes organizations are watching now is the LDL, or the bad cholesterol. So a lot of people with diabetes, again, you're going to be on a cholesterol medication, and the recommendation is to have that LDL at 70 or below. So, why do we monitor all of these things? What does blood pressure and cholesterol have to do with diabetes? Well, all 3 of those conditions can affect the health of your vascular system. So your arteries and your capillaries and your veins. So high blood pressure can damage those, cholesterol can damage those, diabetes can damage those. So if you have all 3, or if you have 1 or 2 and a potential for the other one, by managing those conditions, all 3 of them, helps protect all your blood vessels. And so then what we do is we protect all of the organs that are at the end of your blood vessels, and we help you reduce or prevent any complications of diabetes. And then there's a lot of other things too. And again, we're going to go more in depth into why we do these things. But your healthcare provider should hopefully be making sure that you're having your diabetes eye exam done every year, that you're checking your feet every day, or that you see a podiatrist regularly, especially if you maybe have thick or difficult to trim toenails. You want to see a podiatrist. If you have calluses, you definitely want to be seeing a podiatrist. You do not want to try to scrape those. A lot of people can develop what's called neuropathy, or nerve pain. And especially it seems to start in the feet. So you might have reduced sensation in your feet. And if you're trying to scrape off a callus, you could get way too deep and open up all that skin before you even feel it, you're going to have an infection. That's another reason you want to look at your feet every day. If you step on something, or if you've got some, broken open skin for whatever reason, you need to know about it so that you can keep that area clean and dry, and you don't get an infection, because people with diabetes are going to be more prone to that, especially if you have neuropathy. And one other place that we often forget about is the dentist. People with diabetes, especially if you're not able to reach your target just yet, having that high blood sugar, that can cause a gum infection. It can lead to gingivitis or gum disease, also known as periodontal disease. So if you don't have a dentist, ask your healthcare provider for a recommendation or a referral and get yourself set up with one. So again, those are just, a few of the things. There's more that we want to monitor with you over the course of the year, every year, to help you keep healthy. And we are going to be doing some much more in-depth explanation about why, because we can ask you to do things, but if you don't understand why, it's not really very helpful. So those will be coming up in the future. So keep watching, and I'll see you next time.